So this meeting is being run with Zoom protocols. It's in person and on Zoom, and that's to encourage public participation. Remote participation is provided as a supplemental way to provide public comment, but this method does not always work. The public has been encouraged to attend in person to ensure full participation. Public comments may be made in person or remotely via Zoom, and interpretation is available. During public comment portions, attendees may use the raise your hand feature and will be called upon and unmuted when it is their turn to speak. So everybody who wants to speak will be provided with an opportunity to do so. The meeting will also be streamed on Channel 27, on Pacific Coast TV, and on Facebook. If you're joining by phone, use *9 to raise your hand, *6 to mute and unmute. So now I'm going to turn it over to Victor, and he's going to translate that into Spanish.
Thank you so much. Good evening, everyone. Victor Hernandez here with my colleague, Ron Obregon. We're with On Point Language Solutions, and we're going to be providing Spanish interpretation for this entire event. Muy buenas noches. Víctor Hernández aquí con mi colega Ron Obregón. Les vamos a brindar lo que es traducción en directo, es decir, simultáneamente para todo este evento. Así es que si necesitan un aparato, por favor, vénganse aquí a la mesa y les daremos uno. Muchas gracias. Thank you so much.
Thank you, Victor. So for those who don't know me, my name is Sandy Winter, and I'm standing here before you today as part of the leadership of the age-friendly Half Moon Bay Coastside initiative. So this was something that was started in 2021. We gathered a whole lot of information from older adults about what their unmet needs were on the coast. And we looked at that information and we designed an action plan for how we could tackle the unmet needs of seniors on the coast. We spent a couple of years getting ourselves up and running, addressing those initial issues that had come up, and we have just recently gone through a process of updating our action plan. So we now have a new three-year action plan that will be starting in September. And it's to do with things like raising awareness of housing, business recognition, community advocacy and awareness. And one of the things that was started under the original initiative and is continuing is to advocate for healthcare access on the coast. And so Age Friendly is facilitating this meeting in partnership with the city because we want to gather information from people. So actually you can go to the next slide. So what we're going to do today is I'll explain a little bit about what we're here to do. We have some definitions of care. So what is urgent care? What is emergency care? What are the differences? Then we're going to hear about an urgent care pilot program that has already opened on the coast with Dignity Health. Then we're going to have a panel of local healthcare providers who will be here to answer your questions. So if you have questions or comments, you'll be able to ask them of knowledgeable individuals. And then we'll wrap up with what we need from you. So first of all, why are we here? We want to share information about healthcare options. We want to let you know about what's coming in terms of the Dignity Urgent Care model. We want to answer your questions, receive your input, and learn what it is that you want and need. And this information will be used to inform future decisions and advocacy and actions that we can take as a community. So I'm now going to turn over to Claire Touton, and she will give some definitions of emergency and urgent care.
One of the things that people always ask us is, what are we talking about? Is it urgent care? Is it emergency room? Aren't they all the same? What's the difference? What's going on? So I did just a little tiny bit of research on exactly what the differences are. Emergency rooms are much more standardized. They have to have specific licensures, and there's different levels of emergency rooms. There's everything from specialized like trauma, and comprehensive, which is like Stanford, or basic, which is most hospitals, or standby, which is what Seton has traditionally offered. So what is standby emergency care? What have we been used to having here? It's open 24 hours a day. As an emergency room, they have to see anybody that shows up. They can't turn people away. There has to be a nurse on premises, not a doctor, but a nurse. There has to be a doctor reachable in a quote, reasonable amount of time. I think that actually usually exceeded that standard, but it's not required. And they need to have life-saving equipment there and know how to work it. In other words, they need to have a defibrillator, a ventilator, a cardiac monitor, IV equipment, and that sort of thing. So how is that different from urgent care? Urgent care standards are much less stringent. Not all urgent cares are alike. Some are almost like emergency rooms. They have everything. Some are basic, like your family doctor. So what does characterize an urgent care center? They have typically have expanded hours beyond what you would expect from your family doctor. They usually are less expensive and more user-friendly than an emergency room. They are designed to assess and treat conditions that really can't wait. They're not going to be life-threatening, but they're serious. They have physician and non-physician staff who often play more than one role. So they're fairly flexible in what they do, like the nurse may draw blood or something like that. And I want to stress that not all urgent care centers are the same. You'll be hearing tonight what the new Dignity Urgent Care Center is going to be able to do when it opens, but that may not be where it ends. There may be more to come. So I'll step aside and let you hear about that.
Is Sarah here? Okay. Oh, you are? Come on up then.
Good evening. My name is Sarah Finnerty, and I'm the physician that was hired by Dignity Health to provide urgent care services during this pilot program. My training is as an emergency medicine physician, and I'm board certified in emergency medicine, but have exclusively been practicing urgent care for the last 6 years, primarily in person, but also remotely with telehealth. So the pilot program at Dignity, my understanding is in response to the needs of the community and from the funding from San Mateo County to provide and make access to healthcare that currently where there's a need. And pretty much we're expanding on, it's an expanded primary care model. So the primary care clinic is the location of the urgent care, where primary care is being practiced exclusively up until now. And that is something that I would say most urgent cares typically do have, but this is something I think that I know they've looked hard at obtaining, but have not obtained. So there's no on-site X-ray. The intention is to be welcoming to anyone that needs care. So regardless of insurance or ability to pay, the urgent care services are open to everyone. That is not to be the primary care provider for those patients, but for same-day needs, including, for example, the need for medication refills for a short-term basis, like 30 days prior to establishing care with a primary care provider. A great person to be, the ideal, I guess, person to seek urgent care services is someone that needs expeditious care in whatever way they define that. But it is also important that we not attract patients who have true emergencies and delay them getting definitive care for serious complaints, such as chest pain, shortness of breath, weakness, or symptoms that would be consistent with a stroke or a heart attack. So we don't want to be giving the impression that those are things that we can adequately handle, because we can't. The facility is at 799 Main Street, Suite D, which is, I don't think it's hard to find, but it is not right on Main Street. You have to, I think, know a little bit about where it is. And for now, I am currently the provider working Wednesdays through, oh, thank you. Wednesdays through Saturday from 9, there's an hour lunch break, and the services will go until 7:30 p.m., meaning anyone could walk in the door up until 7:30 p.m. and be seen. Does anyone have any questions? Yes. Yeah, so I've positioned myself. Oh, sure. The question is, who's going to be doing triage when someone comes in to make sure that people are being assessed upon their arrival? So I have positioned myself right within 10 feet of the front door to be sort of an earshot of who's coming in. But if I'm in a room, there will be 2 other designated staff to be working exclusively in the urgent care in addition to the regular primary care staff. And that is someone working at the front desk, as well as a designated medical assistant for the urgent care. And between the 3 of us, that's our job, to keep a close handle on who's coming in and do exactly that, is triage them. Yes. COVID, flu. Oh, yes. The question is, what kinds of point of care testing are we going to be able to do? Flu, COVID, RSV, mono, urinalysis. We have ordered, I don't have it yet in my hands, but an iStat, which can do basic electrolytes and check a hemoglobin. We primarily work with Quest Lab for things that need to be sent out. So someone comes in with symptoms of a urine infection, we dip and check their urine with a point of care urine testing. If more testing's needed, like a urine culture, that would be sent out to Quest. Another point that I think is important to make is that what will be covered by the county and through this program is anything that we do in-house is covered. So I'm taking some extra steps and measures to say, to inform someone, you know, I really think we need to send a urine culture here, but that wouldn't be covered in this program. So that would get billed, you know, that would be an insurance cost, or if someone didn't have insurance, an out-of-pocket charge. So I'm going to be really careful about informing people about what is covered and what may not be covered. If someone has insurance, all the services would be billed through their insurance. But if extra testing, meaning things that weren't within the 4 walls of the clinic were to be done, those wouldn't be covered, and I would want to make people aware of that. Additionally, we can do finger stick blood sugar and hemoglobin A1C as point of care testing in the clinic. Yes. Yes, the question was, can we handle a gash or a laceration and sew it up? Yes, or dermabond it or steri-strip it. But yes, we do have what we need to do laceration repair. Yes, and what I would just highlight is that STD testing is an example of something where that's a send out. So that is, we can obtain any specimens for STD testing, including blood draws and any specimens that are needed, but those are all send out tests. And yeah, yes.
Chest pain or something that you think might be a heart attack or stroke, you just call 911, or are you able to do EKGs, start IVs?
We do have an EKG machine and can do an EKG. We do have a defibrillator. We do not have IV, the ability to start an IV or start IV fluids. We have an emergency medicine kit. For example, if someone presents an anaphylaxis, we have the medications and the things we need for that. Someone presenting, depending on how they present and the level of concern, the safe way to transport someone to the level of care that they need, if there's concern for, in the case that you just said, a stroke or acute coronary syndrome, they would be sent by ambulance. We have oxygen, we'd put them on depending on the situation. We don't have a lot in the way of being able to stabilize someone for transporting them. So we would be calling 911 if someone presented with a concern that needed immediate attention. Okay. We do treat patients that present with asthma. We have a nebulizer and nebulizer medications, peak flow meters, and can certainly treat and have been treating patients presenting with asthma symptoms. It's all about degree and severity. So someone who has severely labored breathing, who's got a low oxygen saturation and is going to need more than the care that we could provide them, including maybe even a shot of steroids, is going to need to seek more advanced levels of medical care. On the bottom, facial lacerations. I would say the bulk of facial lacerations is something that we can do, but depending on the severity of that and that person's desire, for example, to be evaluated or seen by a plastic surgeon if that was needed. So those two things I would highlight are things that are dependent on severity.
Okay. So we're actually going to take questions and answers when we have the panel. So you'll still have an opportunity.
May I just add something real quick to this section?
Yes.
So my name is Ray Mueller. I'm the county supervisor, and my office worked with the county to go ahead and bring this pilot forward to the coast. If residents have feedback about this pilot or concerns, I really would ask you to go ahead and contact my office, or after the panel this evening, you could talk to Marisol from my team, who's here to go ahead and take that feedback. But we really funded this pilot in order to fill this need on the coast. Thank you.
So thank you, Sarah. That was very helpful. And I don't think, oh, is Dr. President here yet? Not yet. So maybe you can join the panel until she comes. So now I'd like to have the panel members come and sit over here. And then this is your golden opportunity to ask questions. And because we're doing the translations, please make sure you have a microphone so that everybody who's on Zoom can hear and that we can do the translations. So if the panel members can come to the podium. All righty. So I think what we'll do is we'll start off. If you could introduce yourself with your name, the organization that you work with, and your position.
Claire, why don't you start? Okay. My name is Claire Toutant. I'm a mostly retired psychiatrist. I used to work with Dignity and with Kaiser, as well as in Half Moon Bay. At this point, I'm on the Mid-Coast Community Council, who is co-sponsoring this event. And
My name is Dan McMillan. I'm a family medicine physician at Parissima Family Medicine on Kelly Street. We've been there since 2009, and we definitely need more healthcare options on the coast for sure.
I'm Deborah Penrose. I'm a retired general practitioner, practiced on Main Street for about 20 years. Retired now and on city council for 10 years so far.
Do you want to say your name and what you're doing? Just one more
Oh,
time.
Deborah Penrose, sorry.
And Sarah.
Sarah Finnerty. I'll be providing urgent care services in this pilot program for Dignity Health. Emergency medicine physician practicing urgent care.
So some of you will already have completed the survey. We have some questions that have come up in the survey, but it seems like that there are questions from the audience first. So let's do those. And if there is a lull in the conversation, then I will go to the questions that we've had in the survey. Just wait until you get the microphone. Okay. Maybe say your name as you ask the question.
Thank you. I'm Ophelie Vico. I'm the Community Health Director at Puente in Pescadero. My question today is regarding whether participants who are uninsured will be able to be seen. I think in the presentation said regardless of insurance, but does it mean also if you have no insurance, you will be seen?
Yes,
And will they be provided with a self-pay sheet prior to services being provided to, see if they can afford your services?
yes.
Okay, thank you.
We got one over here. Hi, my name is Wendy Schaefer and I live in Half Moon Bay, and this is more of a comment than a question. Looking at your hours, I would really urge you to consider picking up Sunday, even at the expense of Monday or Tuesday, because having to go over the hill on a Sunday for an urgent care could take a very long time.
Hi, Sid Young in Moss Beach. Normally I go to Redwood City to the Kaiser over there. So my question is just about this concept. Are you trying to make it more convenient for other people that have insurance just to get served locally? Or is there going to be an upcharge? Like if I would rather just see someone here, would I skip driving over the hill and I would be charged the same amount, or is there an upcharge to the insurance?
there's no upcharge. This pilot project, due to the generous efforts of Ray Mueller and the county, is helping assess how much interest and how much need there is on the coast for this kind of service. And the service is set up to see anybody who comes in. If your insurance will pay for it, that's great. And we want that, but the biggest thing we want is for people to use this service. If this opens and no one uses it, we may not look at something like this again. So the important thing is not to worry about the money part. The important thing is to use it.
But is it true to say that it's not for primary care services, it's for urgent care services, right?
Correct.
So it's not a replacement for your normal healthcare. It's for urgent care. We don't want so many people with normal healthcare concerns going that urgent care people can't get in.
So if you see somebody with like a wound on the lower extremities, say, and they don't have insurance, how are you guys gonna follow up? Would you see them back in the urgent care for follow-up? Because people like, if they have lower extremity edema and then they have a wound, it's like potentially not a great situation if you just see them one time and then let them go.
So for example, in the case of a laceration that was sutured, they would need suture removal. And certainly that would be part of the care that was provided. Someone has a chronic non-healing wound for 2 years on their lower extremity. That's a chronic condition. And certainly if they were seeking, if something changed about it or they were seeking attention for that, we would provide that care, but not with the intention of assuming the ongoing care for that patient. The idea isn't to become the primary care provider or the potentially, depending on the situation, the final solution for that person, although it may be. But if someone has it all depends on the chronicity of the situation and I think the specifics of it.
So you guys could have the ability to like get them connected with Medi-Cal or so they can get the ongoing care that they need if they didn't have
Correct. And
insurance.
refer people out. If there is, like in the first scenario, sutures are placed and suture removals needed, that's pretty straightforward. But if it's anticipated to be an ongoing problem, then we would need to connect that person with care for ongoing services.
My name is Erwin Cohen. I'm a podiatrist here on the coast. I've been practicing here for many years. I'm right next door to Dr. McMillan. My question is, will this situation eventually blossom into a situation where you could take x-rays and take blood for analysis?
I think that the idea is that we know we need lab here on the coast. We need blood draw. We need x-rays. But the county is only able to provide us with this urgent care for the 6 months that it's going to be in operation. It does not include routine lab work or x-rays. Whether this pilot program expands and can do those things will depend largely on what is the need for urgent care here on the coast. And that will be determined by how many people show up at the urgent care for help. So if nobody goes to the urgent care for 6 months, the program's dead. We won't get x-ray here. We won't get lab draw here. But if people use it and overuse Dr. Finnerty's services so that she can't see any more patients, she's going crazy, then that will help our case.
And I'm sure they'll be gathering lots of data and all of the decisions will be informed by the data. Jessica, are there any questions on the Zoom that we should be taking?
I have some that were typed in. One, how do you coordinate with emergency rooms? And then another question about Sunday hours.
As of November, starting in November, we're providing these services in these hours from Wednesday through Saturday. Starting in December, it is my understanding there will be some additional days added with the addition of another provider. As far as emergency services go, again, depending on the acuity of the situation and the needs of the person, someone who needs emergency services, 911 would be called and they would be taken by ambulance.
And then someone asked how data collection is designed.
I am not aware of any data being collected outside of just the regular billing codes that we're using. So for example, the number of patients coming in and what they're being seen for, which can be identified through the codes that are used when you complete a chart and do billing for that chart. So those are through ICD-10 codes. I'm not the final answer on that. I don't know what other tools are being used for data collection.
Hey, hi, I'm Scott Bollinger. I live in Miramar. And I have a question about how you're going to assess whether you need more extensive services like an actual emergency room or something like that. So I read your list, what you can and can't do. So if I have like a I fracture my skull mountain biking, or I break my arm, or I have chest pain, if I don't come to you first and you assess me and send me on, you'll never know that there was a need for that, right? If I just say, hey, you can't do it, I read your list, I'm out of here, you'll never know.
We're not trying to provide that need.
But if-
Dignity Health Primary Care Clinic is never going to be able to meet those needs.
Okay, so you'll never expand to anything like that?
Not to that, no,
Okay,
no. Dignity will never become, well, I'm not going to speak for all of Dignity. That facility at 799 Main Street,
Okay.
Suite D, I can tell you, I've been in it, I'm in it.
Yeah.
There's no way it can treat your skull fracture ever. It will never be able to treat your skull fracture.
okay.
We do have data from emergency medical services, which would give some indication of some of that.
So you would know where I'm from?
Uh,
So if I go to Mills, what's my problem? If I drive myself to Mills.
if you drive yourself, we don't know. But not with your skull fracture.
Please don't.
So there's another question over here.
Mi pregunta es, ¿cómo van a más personas en la comunidad van a saber sobre el acceso a esta clínica? ¿Cómo
So-
van a poder compartir esta información?
How are you going to share all this information so that more members of the public know about this place?
¿Y cómo van a ayudar a las personas que no pueden comunicarse con su idioma?
And so how are you going to go about with people that can't communicate in English or in your language?
Do you want to speak to the?
That's part of why y'all are here. We've been working really hard to send out flyers to every place we can think of. And we've got Coastside Buzz and such people work spreading the news. But we really are depending on people that are here now to tell other people about this.
And there's a lot of partnerships with community-based organizations who are being asked to share their information with their participants. Regarding the language issue,
Yeah, some of our staff is bilingual and we have translator services. So we certainly can, we can address whatever language someone comes in speaking. We have translator and interpreter services that can assist us with assessing that person.
there's another question at the on Zoom.
I have a raised hand from Elizabeth. Elizabeth, you can unmute yourself and make your comments.
Hi, thanks. Regarding what the previous gentleman, a couple gentlemen ago, questioners ago asked, how would this pilot program help with more serious emergency room kinds of needs that the Coastside has? No, Coastside obviously has these needs. We need X-ray, we need blood draw, we need more extensive. We really do need an emergency room because of the nearest emergency rooms being so far away. So is there a chance that this pilot program will somehow be used or can be used to demonstrate the need for an emergency room on the coast?
I'm not going to answer that because I just don't know enough about the coast needs. However, my understanding is, please correct me, this is what I've been told, that there's Seton Hospital which plans to reopen.
This is Dr. President, who's also from Dignity. So, I mean, I would say that the problems with healthcare access on the coast are substantial, and that one option is not going to provide all of the answers. This is a pilot test. It's an opportunity that we haven't had before. If it's successful, we'll be able to motivate for or advocate for additional healthcare services, which may include an emergency room, which would likely include laboratory work and X-ray work. But we've got to make a start somewhere. This is a 6-month pilot program. It's not going to provide all of the solutions that everybody wants in the long term, but it's a start. Dr. President, would you like to introduce yourself?
So I'm Dr. Marie President. I'm the Regional Medical Director for the Bay Area for Dignity And I am in charge of the outpatient services for Dignity. So the other title is CMO, which always kind of bugs me a little bit.
And thank you, Dr. President. It's good to have you. And Sarah's done a wonderful job of answering everybody's questions and presenting what the Dignity Urgent Care Pilot Program will be doing. So we have another question here at the front.
Once the hospital opens, what's going to happen to the facility on Main Street? And the other question is, if you look back historically, you could see that the Moss Beach Hospital at the beginning and was a going entity, and that was years and years ago, and then it turned into St. Catherine's, and people were coming there for blood, for X-ray. Why do you have to look for data when it historically demonstrated a need?
I don't mind answering that question. Obviously I don't. Do you mind if I stand up?
No.
Obviously I don't work for Seton. I don't work for the county. I don't, I'm not the whole, hi there, how are you? I'm not beholden to, I'm not a politician. I'm just a doctor in leadership. And I think what we witnessed at Seton, we were privy to tour the facility. Thank you for making that happen. I think Seton is very committed, and you guys please chime in. I think they're very committed to staying in the area. They had many chances to leave and close ship. There was a very good reason why they closed. Trees fell into the building. We're lucky that a lot of the inhabitants there were not killed. And if it wasn't for the action of some of the medical staff there, I think people would have been, patients would have perished. And unfortunately, am I saying something that was already been told?
No.
Okay. Unfortunately, when they opened up walls to do a lot of the rebuilding, they found asbestos. And so, as we know, we can't put people in harm's way with asbestos. They've done a lot of work so far, wouldn't you say? We saw a lot of new equipment, a lot of new radiology equipment, physical therapy equipment, physical therapy room for the community, occupational therapy. A lot of that stuff was in their kitchen. They're rebuilding the kitchen. I think what we need to do, and I think what we've been doing, and I'm a pushy little broad from Oakland, honey. I'm from East Oakland. I'm very pushy. Is to provide a collaborative experience for Seton by saying to them that we're all in this together. And by the way, I live here. I live in Half Moon Bay. I live in Frenchman's Creek. Lending our services as clinicians, lending our experiences in leadership, lending our services in IT so that all the computers can talk to each other. So that making sure that they have contracts for all insurances like Kaiser and everyone else. Making sure that it's not a rivalry, but we're actually working together, and making sure that the marketing is there. How you doing, Ellie? The best medical assistant. She used to work at Seton. Coastside, and she's one of our she's our lead medical assistant here at Dignity in Half Moon Bay. We're not gonna let up on them. We're gonna, I wouldn't say pressure, but we're not gonna let them forget the commitment that they have, and that it is actually not hard to run an urgent care alongside emergency department. Every major medical center in California does just that. And so we're not talking about two things that are mutually exclusive. we're talking about the additional services, and maybe to try to get rid of some misinformation and mistrust. So I'm sorry, I said too much.
I would like to hear from Dr. McMillan as a primary care practitioner, what his thoughts are about having an urgent care.
I think it's very much needed. There's, there's as a small family practice clinic, there's only so much we can do. When we first opened in the area, there were Doctors Penrose, Carrington, Quest, Enriquez, Lasani, they're all gone. And so there's ourselves at Parissima, there's Dr. Cohen for podiatry, there's Dr. McKell, but there's just not enough options on the coast right now. And so I'm all for it. I think having an urgent care available on the coast is great. I think it will get used. I think if we all spread the word and people know about it, I think it will get used, especially if they can take all different types of insurances, including Kaiser. I think, just to speak to the emergency room question, this is a problem across the country. I mean, rural areas, hospitals are closing, emergency rooms are closing because it's very expensive. And if they don't have the use to keep to pay for the services, they're closing. And that is one of the costs of living in a rural area, is that we don't have the access that people in urban areas have. So I'm not defending it. I'm just saying that's just the reality. Like, you look across the country, small hospitals in rural areas are closing. Did I answer your question?
You did.
Yeah.
Thank you.
Yeah.
And I would just say, speaking from the perspective of older adults, many older adults are no longer able to drive, and getting over the hill is a real challenge. And so having healthcare that's accessible on the coast is important. And I said it before, I'll say it again. This is a first step to trying to improve the healthcare that is provided to everybody. You have more
It would be,
questions?
I would say it would be huge, if basic X-ray services and lab were able to be provided. Just for my patients, that's one of their biggest complaints is, man, I have to go over the hill for a routine X-ray or a lab test. And unfortunately they do. I mean, Dr. Cohen has a small X-ray machine, but that's it right now on the coast.
If everything works out the way Dr. President is depicting it, at some point, we'll be able to use lab and X-ray at Seton, and we'll all be happy.
What we've discussed was we know that Seton has contracts with everyone, Kaiser, the county, whatever. And actually, even before they closed, this was something that we didn't know, that they actually could accept folks from every insurances, but that's where it's not misinformation. That is information that we did not know. And trust, I called many times. I couldn't get anybody who actually knew anything. And so that's one of the things that we want to do. We want to build a coalition of information because we've got this place here. We can all work together to provide all those services to everyone here. I'm gonna tell this story. I've always told this story I told this story once, but I'm gonna tell this story again, why I'm so passionate about this. I was being treated for cancer 2 years ago. And the chemotherapy was killing me. And I had to get in my car every single day to drive over that hill, nauseated, tired, and feeling horrible. Stopping along the way on the windiest part of the road, and then taking really an hour plus to get over the hill just to have labs done, just to have an injection. So that's why I'm so passionate. That's why I've got myself involved in this. And I intend to see it through to the end.
I think we have a question at the back there.
Yeah, there's a question on Zoom. Is the pilot urgent care designed to target tourists as well as residents?
Did you say tourists? No. Yes. Yes.
Question over there.
So I just have a comment. So my name, again, is Supervisor Ray Mueller. I appreciate Dr. President's, thank you, Dr. President. I appreciate her optimistic outlook on what the future may be with respect to the emergency room at Seton. But I do want to share with everyone, the obligation right now in the Attorney General's agreement only goes until 2025. And the latest information we have from Seton is we do not have a definitive date when they will open, and they have pushed that to spring of next year. So even if it does open in spring of 2025, if that gets pushed later than that, we're really looking at only a half year of emergency room care guaranteed by the Attorney General agreement. So if there are people here who think that we should have a tolling for the time period it's been shut down, so that we can see whether or not this pilot actually moves people to that emergency room, we really need to hear from you. We need to give you that, we need to hear from your feedback to the folks here today. We really are pushing the Attorney General now to toll that agreement and add time to the amount of time that that emergency room is open. Thank you.
What Scott brought up when he suggested he might have a bike accident. I believe our property taxes cover the AMR ambulance. But have you reached out to the fire department, because they might be able to bring people to the emergency Dignity Health?
If I'm being honest, if somebody needs a ambulance, they probably shouldn't be going to the urgent care.
I don't know. I'm just saying
Yeah.
that that's one more outreach that
Yeah.
you might get some people brought to you.
And
There are statistics on emergency transport agencies, the fire department and the ambulance doing non-emergency transport. So that's something that's worth looking into.
They often they don't do a lot of structure fire suppression. A lot of times they get called for a lift assist and other health things at people's homes.
Mhm.
And so that's what I thought. I would just help you out. And they could maybe bring customers, especially you weren't here when the question came up to be open on Sundays. But if you live on the coast, you know how traffic is on the weekends. Thank you.
Well, this won't affect RotoCare, will it? The weekly free
Is RotoCare
clinic?
still-
No, okay, I was just making sure.
Is RotaCare still operating?
I don't know, I used to volunteer there.
I know, it
but
hasn't operated
was a
for
great
several years.
Service, I thought it was still up and running.
In Half Moon Bay? No, it's not in Half Moon Bay. Yeah. We can't hear you.
Microphone.
Can't understand you.
Sorry, I'm losing my voice. But on Wednesday evenings, RotaCare is available at our Coastside clinic. Wednesday evenings,
Okay,
RotaCare.
good to know. Thank you.
Thank
I
you.
didn't hear what she said.
RotaCare is available Wednesday evenings at the Coastside Clinic. Is that right? Okay.
Wow. RotaCare.
I'm just wondering if we know what happened. There was a Stanford clinic where the county clinic is now in Strawflower Shopping Center. What happened with Stanford and why did that fail? Because I think they had x-rays and everything at one point.
So Stanford, this is before my time, but I can attempt to answer. Stanford pulled out of the Coastside Family Medical Center. Ellie, maybe you should answer this, but they or a vet, I don't know, maybe you know, but they pulled out 2006, 2007, and they formed a nonprofit organization to keep the clinic operating. And you're right, they did have x-ray, they did have labs. And then, the financial crisis in fall of 2008, that Coastside Family Medical Center always relied on money coming in from other sources. And that year with that financial catastrophe, there was no money coming in and it went bankrupt in March of 2009. So, but I think for Stanford, when this is before I was there, but I think it became financially not profitable for them. And I don't know if that was the payer mix of the patients with the different insurances they had, but they left and the Coastside Family Medical Centers respond to try to take the place. Ellie, anything to add to that? No? Okay. All right.
So there was a question about what is Rotacare. Rotacare is a clinic that provides healthcare to people who don't have insurance, and it's run out of the clinic in Shoreline Center by the Rotary Foundation. Their healthcare arm is Rotacare, and I think Dr. Macmillan, Dr. Penrose volunteered there. I was a volunteer there, Claire. So we used to volunteer there.
I have not for at least 5 years. So.
Right.
It's been a while for me too.
I have a question over here. I came in late, unfortunately. Are there slides that we can get online of this meeting with the information? And maybe you're yet to address this, but how can we as individuals here, how can you utilize us to go out into the community with the information we need to give to people? There were people that I was surprised did not know about this. So obviously we need to do more work to help you get the information out.
You have, this is being recorded. It'll be available on the City of Half Moon Bay's Facebook page. I think it'll be available through Pacifica TV, Channel 27.
YouTube as well.
Yeah, and YouTube. Maybe you could share that slide again when we finish up.
Has there been an article in the review? There has been.
And there's also been an ad on the KHMB radio. And as I mentioned, a lot of the nonprofits received this announcement, the library, various government agencies, and have been sharing the information with the people that they know of. But if you know of any particular groups that you think we should connect with, then please come up and speak to us or some of the city people, and we'll make sure to get the message out.
Or will specifics go out from you?
So my understanding is that there is an urgent care, this flyer came available today. It is literally hot off the press. And this describes the urgent care, when and where you need it, the opening, the hours, the address, so everything is on this flyer. There are some flyers over there. So this, I think, would be a very good start.
And the big release is not until next week. In terms of the word about the urgent care services. Like I said, I'm not a politician. There's a lot of things that have to pass the muster. It has to go through this person and that person in leadership. And because it's a county joint venture, it has to meet county standards. I'm a get it done kind of girl, but I have to sort of stand back and let the people who know what they're doing do it. So you'll probably hear a lot more about it by next week. There's going to be a ribbon cutting. There's going to be some of the news people are going to be featuring this on the news and that sort of thing. So there's a lot more to come. Yes, but if you want me to be honest, we actually have already started delivering services. The hard opening is November the 13th.
Is the Coastside Buzz? I know it's been sent out by Michelle. Question over there.
I guess this is more of a comment rather than a question, and it sounds like it's going to fall on some good ears based on the people in the room, and I don't know that this is common knowledge. But in San Mateo County, if you earn, and this is related to access to care, whether it's primary care or urgent care, but in San Mateo County, if you earn minimum wage and you're a household of two working full-time, you do not qualify for Medi-Cal or ACE. And I think this is a big issue. I mean, I don't know, if federally this can be advocated for, but I do know that the San Mateo County program of health insurance ACE, this could be advocated for to raise the federal poverty line, because a lot of participants and people and clients that we have at Puente who are earning minimum wage, which most of you, if not all of you, know that living in the Bay Area making minimum wage is not enough money whatsoever. They are, placed into covered California, which can be $300 to $600 per month out of pocket. And on a minimum wage paycheck, this is a lot of money. So this is more of a deeply rooted issue that obviously, like Sandy mentioned, this isn't going to fix all the issue that there is on the coast side of access to urgent care. But I do think that this is something that should be kept in mind. And if there's anyone in this room who does advocacy on health insurance enrollment, et cetera, I think that this is good information to have, that the federal poverty line and even the San Mateo County poverty line is just not high enough. People do not qualify.
Thank you.
Yes, Jessica?
We had another question. Will the urgent care pilot be able to handle immediate child deliveries?
Please repeat.
Will the urgent care be able to handle immediate child deliveries?
You probably don't want to.
Answer that question. Do I know what to do? Is that the question? Yes, I know what to do, but that would be a suboptimal experience for everyone.
It's not a typical thing. Along those lines, what's the youngest patient that you guys would see?
0 infants to, there's no age limit for this program. The younger the child, a very, very young newborn infant, depending on what the situation is, they may be referred to seek care elsewhere depending on what the issue is, but there's no one that would be turned away or not evaluated based on age.
I have a question over here. Need a microphone?
Hi, everyone. Can you hear me?
Mhm.
My name is Tim Schultz. I'm with Seton Medical Center. Earlier, there was a comment that was made. If you don't have insurance, for whatever reason, you don't qualify for insurance, your income is too high. I recommend all of you come to Seton Medical Center. We have charity care available. There's millions of dollars set aside to provide free service to the community. I need help getting the word out to everyone that if you need healthcare and you don't have insurance, please come to Seton Medical Center for your care. I'm working on getting the information into the local papers here. I don't think there's enough information out there for the community to know that these services are available. We work very closely with RotaCare. RotaCare sends a lot of patients to our facility for laboratory, for radiology. So the funds are available, and I just need help getting the word out to the community to send your patient.
And Tim, you're talking about Daly City, not Half Moon Bay,
It's
correct?
both.
But currently Half Moon Bay is
Yeah,
not open. So
correct.
right now it would be Daly City you're talking about.
Yes.
Thank you.
Hi,
She meant Moss Beach, yes.
I guess this is a question then for the gentleman with Seton. If it's really good to hear that there are millions of dollars, and I guess 2 questions. One would be, what would the phrase or sentences someone would need to say to not have any hassles when they first arrive? to be able to access the charity services? And is it possible for you to advocate for the donation of an X-ray machine and an X-ray tech to support this urgent care clinic?
So with charity care, there's information on our website. If you go to ahmchealth.com/SMC, there's a tab on the website that you can click on that will take you to the charity care information. So when you're presenting at the hospital, you just need to mention that you don't have insurance, right? You don't qualify for insurance, you don't have insurance, and you're here to receive charity care. And so it's available. It's underused, and we want to get the word out and make sure the community knows. In terms of donation, I need to check on that related to the X-ray machine. That's above my pay grade. But when Seton Coastside does reopen, the current timeline is spring 2025. We do have basic radiology services available. There are basic laboratory services available. Those services had been available for a very long time at that facility, and we want to continue those services.
So a lot of the questions that were asked in the survey have been answered, but there was one in particular that hasn't been asked yet. So the question is, we get lots of visitors here from out of the area, including out of state and international. Would emergency or urgent care services be available to help them? And the answer is yes for everybody on Zoom. There's a question at the back.
I think this is a good opportunity to clarify something because the way things have been answered, I just want to make sure it's 100% clear. The county funding that's being utilized to make this urgent care pilot happen is meant to be a backstop. So as was shared earlier, if you have insurance, whatever insurance it is, including Kaiser, you can go there and get services. Also, if you don't have insurance, you can go there and get services. If you have insurance, they're going to take your insurance and they're going to bill your insurance provider as you would expect. If you don't, the county funding is there to make sure you still get those services. You will not have to pay out of pocket for that. I think that's a really important message we need to get out, is that literally everybody, and we just heard tourists, international visitors, everybody can come to this urgent care clinic and get services regardless of your insurance situation. And the whole point of that is for us to really understand what the need is and demonstrate to the insurance carriers, to the service providers that serve our region, many of whom are in the room tonight and many of whom are at the table with us as we try to figure this out. If we can demonstrate to them that we are going to use those services and they can make money to provide those services, we have a much better opportunity to bring this here permanently. So that's why the county's doing this, also to backstop while Seton is closed. So that's why we're doing this tonight. That's why we want you to get the word out, and we want you to use these services. We hope you don't have to, right? We hope you don't need these services, but if something happens, please take advantage of them. Demonstrate the need, demonstrate that we as a community will support something like this. So hopefully that clarifies kind of some of the questions that have been asked, and thank you.
I have a question. Are you gonna take just walk-ins or can people call and for an appointment? Both? Okay.
All of the above.
right.
They can call, there's gonna be an online. Oops, sorry, I thought I had a big enough mouth that I didn't need it, but they can call. There's gonna be a online, a way for them to make appointments online. We have a major call center that if the call happens to mistakenly go in through the main Dignity portal, those patients can be scheduled. Yeah, and they can just walk in. So, I forgot the big one. and telehealth.
I don't know what that is.
Video visits. So for if a patient is out in, Pescadero and can't get in and it's appropriate for telehealth, we are going to be doing telehealth, including yours truly. So.
So people know where you are.
Oh, baby, the signage. Lisa, do you want to take that signage question?
So I can answer that.
That's
Yeah,
a loaded
the
question.
signage is being worked on. There are some sort of rules and restrictions that everybody's working together to try and solve. So it's being in the process of being addressed. And there's another question here at the front.
Yeah, I was just wondering, I have a handicapped child in a wheelchair, nonverbal, and she can't move, but we can read her eyes and we know what she needs, food, crossed eyes, that kind of stuff. Is the wheelchair is an issue because we can't always, we have ramps and stuff, but do you guys have ramps? Are we able to bring kids there with disabilities?
About 20% of our patients that come in are non-ambulatory. So, yeah.
And then the other thing was, I was thinking about the X-ray machine, which is at Seton, which is not being used. Is there any way that could be, like that room could be, or is it being used?
So the way I see it is some of the X-ray machines that they use at Seton are monstrosities that probably wouldn't even fit in that office. We do have some more mobile options. The capital expenditure is bonkers. So by the time you pay for the machine, the personnel to run the machine, the training, then you have to interface with radiologists, you have to interface with imaging. By the time you finish all of that, you're upwards of $500,000, and that's just we can't handle that kind of expenditure. So we would need a donation. We would need something. We can do the interface. We can even possibly even train someone to do these things. You have to be licensed, even to put people in a position in front of a machine to do a chest X-ray. You have to be licensed because you can't expose people to, harmful whatever. You have to get the right angles. You have to know anatomy and all that stuff. So it's a really expensive expenditure, and for some of the machines, you just need a ton of space that we don't have.
And so my whole thought was like, if you could remodel that one area in the X-ray area in Seton, and then have some kind of where everybody's doing their work on the other rooms and everything and building, but try to get the X-ray machine area set up first so that we could actually utilize it. That was the idea.
I think even a better idea, and this is something I'm trying to plant in the seeds of some of the people that are in the room right now, is to have a standalone radiology center where people can come in and get whatever X-ray that they need.
And then the other thing I just wanted to point out is I think everybody in this room who utilizes Facebook or Instagram, like I've took some pictures and I hope you guys don't mind, but that's for me to post so we can get the word out. And I think everybody here should do that and staff should do that, because the more we get this word out, it's going to work. The other idea that I was thinking is just basically like at the hotels and stuff, have them know, because we have, as we know, tourists are allowed to use it. So we needed to make sure they know where it's at, and they need to know we do have this facility, because if we do have something that arises, somebody's going to freak out at the front counter and not know what to do. They need to be educated on that. And then the other question I was wondering on physical examinations of school and work, except for Department of Transportation, physical exam or commercial licensing. Can you elaborate a little bit on that?
You have to be specially licensed to do Department of Transportation evaluations. Same with workers' comp. And there's not that many. I don't even know if Stanford even does them. I know Kaiser does it, but they do it separate from the regular So these people are trained in a different way. The state of California doesn't like regular docs like she and I to do those exams.
Okay, so that's something that's, you could do or you can't?
No,
do?
we cannot. It's a state regulation.
But you
Okay.
can do other sports physicals and employments.
One physicals as long as it's not workers comp. And so for instance, if somebody is a truck driver and they're driving across state lines, that's a special licensing. And we can't do those exams.
What about for pilot's license?
Same thing.
Same thing.
Okay.
That's because that's federal.
A component of that.
There's some question, a
Yes.
question over here.
Thank you.
Sure.
In terms of, first of all, I just want to like applaud all of you who've been working on this because it's a wonderful initiative. In terms of communication and getting the word out, would there be flyers available that we could share with our friends and other colleagues? And also, will there be a website that we can talk to people about? And after that, I have
All of the above: website, flyers,
So on the table over there, on the table. over
I
there.
just didn't want to take
there's
all of them.
there's going to be a social media presence. Yeah, all of the above. But Dr. Finnerty wanted to elaborate on the federal guidelines issue.
Well, just to say that, doing DOT physicals or pilot physicals or workers' comp, there's issues around drug testing. And it's an elaborate process. That's all I was going to say. So for example, we can't meet the criteria to do proper drug testing. That's usually part of those physicals. But pre-employment physicals, sports physicals, no problem.
I just have one more comment. In terms of data collection for usage, the hours that you're having are wonderful, but the days that there's nobody available and people need urgent care, there's no way to capture because, numbers are going to be important for this. I wish, there is really no way. Some people would probably go to San Mateo on the days, but I don't know, maybe surveys in the future that people could.
That's actually a really good point. And we'd like to staff it every single day right away, for hours and hours. But, this is a really tough market to do medicine and to recruit. Because it's super expensive to live here. And quite frankly, young people are not going into medicine like they used to. They're going into IT and tech. It's really tough to get a provider in this market with, we're probably slightly higher in terms of reimbursement in some areas, but the cost of living is bonkers, and the cost of doing business here is insane. So we're hoping to add Monday and Tuesday. We'll definitely work on Sunday. We've got some interest in staff and some providers, and so we're hoping to run it 7 days a week, but that's going to take a little time.
Jessica, any more Zoom questions?
Yeah, someone asked about a mobile imaging unit that could be parked nearby the urgent care office, just whether you've considered that or you might consider it.
Oh boy, did we. So there's no shortage of mobile radiology companies, no shortage. But here's the problem. The problem is the crazy way that Medicare, I'm going to blame it on Medicare, because most of the business for mobile services are Medicare patients. And I can blame it on other insurances too. The reimbursement for mobile units to places that are non-home is minuscule. So the way that they make their money is by going to patients' homes. If they will not park, and we've asked dozens of companies, they will not park in our driveway or anywhere in the city because they cannot get enough reimbursement to make it profitable for them.
Any other questions?
You talked about mobility to get to the place and sharing that story. That was that meant a lot to me because people are in that position where you just can't get there. You're by yourself, you know, your partner's not there or something happened. But there's a gentleman on the coast, Dennis, who drives people to the hospital and back. And he lives in my Casa del Mar, in my neighborhood. And he's got a LTD that he bought and he's retired. He's done well. But he wants to stay active in the community. He picks up people at the bars and stuff and brings them home and brings them to the city. And I use them all the time, you know, no drinking and driving, just have fun. But he shares the stories with me all the time that he's always taking people to the hospital or for their care or their, you know, on the other side of the hill. And he doesn't charge a lot of money. I think getting people like that involved where it's community, just as you people are bringing back to the community, we should think the other way around where we can actually have people that have cars that do it and they charge 20 or 40 bucks, but for some people that's well worth it. So that would be somebody I'd like to introduce to you, and he does it already on the coast, and that would be something if you need somebody to drive or somebody else to get involved. So we should try to do that also.
Did you say you needed doctors or staff that you were looking for both? I know someone that lives in Moss Beach and she already does urgent care, but she drives all the way to San Jose to do it. Nancy? Oh, okay.
Question at
I'm Maureen Shostak, and I'm from, I represent the village of the Coastside. Now, we're a membership organization, but we are definitely in the care of older adults. And one of the benefits that we do offer for Village of the Coastside is we do take people over the hill with our volunteers driving from San Francisco to Santa Clara. And there is no charge. We are a membership organization. We have volunteers that will drive anyone that needs help to their hospital appointments. And so I do want to make that known that we're a Village of the Coastside. We've been in operation for 8 years now. We work closely with other organizations, including Senior Coastsiders. And we've had 2 people be our representatives on Age Friendly. So we are definitely advocates of medical care on the coastside, but most important, we do offer a service that many people are not aware of. And we would like to encourage people to look into our organization, villageofthecoastside.org on the website. Thank you.
And there was also Ready Coast. It's not a fabulous service, but it is a service that will take people over the hill for medical appointments. Another question over here.
Yes, my question is, will you have translators available at all hours? And is this going to be a safe facility for undocumented to feel safe?
That is a fantastic question. And we don't play those undocumented worker can't be seen games. Those are games we are not going to play. We're not going to ask people for papers. We're not going to ask people where they're from. We're not going to ask any of that nonsense. So it's a very safe place. And in terms of translation, we do have staff that speak Spanish. And do you want to tell them about the translation service?
Yeah, so it's video, there's video translation services where you pick the language and you interface with a translator. It's all by video. So when you have a membership or access to that translator service, you can choose the language and its I've yet to encounter a language. I've used it for decades and I've never found a language I couldn't get a translator for.
It's kind of weird and creepy to have a person just pop up like that, but it works.
In the office. It is a device that we actually bring from one room to another. Hi, I'm Ellie Wachter, Dignity. So it is a device that you can just put your information in, and then you put, for example, Filipino, and then you have a translator from that language come in. We bring that machine, that doctor is there, that patient is there, and then that translator in that video is there. Any language.
It's really, it's like a little robot that
Mhm.
rolls in, with the screen, and it's like having a third person in the room. I was saying it's kind of weird and futuristic. It rolls on this little thing and has a screen, and it kind of rolls it in. It's like a person standing there in the screen. It's weird, but it really works.
So the other question that I have is in terms of accessibility for a lot of our community, how will the check-in process be? Because some people are not, tech savvy, and I think a lot of cultural things need to be taken into account.
Yeah, we don't
everyone.
use any, that's a very interesting question too, because when I first started my journey in leadership, I thought we should digitize everything. And we had these little iPads in the waiting room, and it was a disaster. In the folks in IT kept saying all they have to do is, but you can't. You can't. So we really do all the check-in for everyone. There is an option to do it online, but I would say that less than half of people put in their information themselves online. We just pretty much use the old-fashioned way. We give them a pen, a piece of paper, or we just put the information in ourselves.
Any other questions? Any questions on Zoom? All right, well, thank you. This has been so informative. I think we've learned a lot from you. I hope you've learned a lot from us. Thank you to the panel for just being so responsive and open. So what we need from you slide is to use the Dignity Urgent Care Clinic as needed. We also have a survey. So it asks, I think, 3 or 4 very basic questions about how you currently get your healthcare, who your healthcare provider is, so that we have more information about that. If you want to fill out the survey, there are some pen and paper forms on the table over there. There are also QR codes stuck up on the walls that you can do it on your phone as well. If you fill out a pen and paper survey, I think there is a city staff member in the corner over there who will take your hard copy of survey. And then on that survey, there's also, I think, some open response. So you could add information. If there's some things that you think that we need to know, feel free to put it on the survey. So encourage other people as well to visit the clinic as needed and complete the survey. And if you need additional information, there is some information on the age-friendly Half Moon Bay Coastside website. And now I think that there's nothing more to do than to hand it over to Dr. Penrose to thank everybody.
Yeah, it's my turn to talk, and it's all about thanking people. We are so grateful to Dignity Health for providing this urgent care, and to Doctors President and Finnerty for coming tonight to explain it so eloquently. We want to thank AHMC Seton Medical Center for their help. We want to thank Kaiser Permanente, Stanford Healthcare, all of these people, Sutter Health, have all been involved over the past 6-8 months, however long it's been, maybe even a year, in trying to get this thing pushed through. We especially want to thank San Mateo County, both the health care folks and the Board of Supervisors, and the county itself for providing the funds for it. We need to thank age-friendly Half Moon Bay Coastside, specifically, excuse me, Sandra Winter, who is the CEO of Senior Coastsiders. Welcome. And our host tonight. And in addition to that, several people who've been on the age-friendly healthcare committee. Connie Santilli, who ran a lot of our things. She's here tonight. Thank you, Connie. And thank you, Harvey Rarbach, for being such an active proponent for healthcare here on the coast. The city of Half Moon Bay, Matthew Chittister, our city manager, Lisa Rossi, Karen Decker, and many, many folks on staff. I can't name them all. They've all been fabulous. Real thanks go out to the Oceano Hotel. Keaton Airhan has provided this room and all of the chairs and all the setup for nothing, for free for us. So thank you, Pete. And thank you, Lauren Jackowitz Fogarty, for working with our staff. Lauren is with Keaton Airhan staff, and she did a great job helping us all out tonight. So thank you.
Thank you, everybody. Good night. Travel home safely. Bye-bye.